But as a warning, I just want to make sure. Once again, email is not effective. It just doesn't have the same research backing it like two-way text messaging does. Two-way text messaging is much more effective. Sending yet another email or an email reminding them that they didn't open up the first email is chasing your tail. I would encourage you, don't send an email reminding people to open up another email that they haven't opened. It's just piling more stuff on them and they're not going to do any of it. Secondly, please don't make the mistake of sending one-way text messages or using your EHR or system that says, yeah, we send out messages on your behalf. They're often from another phone number, another area code, further reducing trust with patients. And if the patient responds and gets a message back saying this number is not monitored or you can't text back, it starts to put up psychological barriers to them getting the care they need and them being honest in their initial evaluation, both of which we want to prevent. Third thing, construct your messages, if you are going to text, just like you would message a friend. Oftentimes, offices start using two-way text messaging, but they send these long, robotic-sounding messages. This is to confirm that Sharon Smith has an appointment on, and then the date format is written in some international format that computers use, and it says, at location, Shadow Lane. Like, that's not how you would text your friend. So saying things like, hey, we will see you tomorrow at our Shadow Lane location at 10:45. That works way better and, again, reduces anxiety and gets people to open up with honesty at their initial exam. So be careful of those pitfalls that seem to make your life easier. Like, it is definitely easier to use one-way text messages sent out by your EHR, but does that really get you the effect you want? I mean, it's easier not even to waste time on diagnosis. Let's just get right to treatment, because that's really what people pay for. But in fact, we need to take that step and make sure we communicate well. We need to take that step and make sure we diagnose well. So the results, patients open up after you knock down those barriers. They open up about the real issue. And you will be surprised with the research says about 12% of your patients will reveal red flags and or yellow flags where otherwise they didn't, simply based on opening up and having that ability to ask questions.